The good news is you can do this. And I'm going to encourage you, whatever you've been through, my prayers are with you, my thoughts are with you.
Hi, I'm Dr. Rola, clinical psychologist, and today I want to talk to you about healing from sexual trauma. This is the second key that I am sharing about the healing process. Before I continue in this video, please subscribe, press the notification bell so that you would have immediate access to my videos. Also, follow me on social media at Ask Dr. Rola, AskDrRola. Now let's continue to talk about this. One critical aspect of healing from trauma in general is self-care. But with sexual trauma, this is especially an important key. Self-care is important because the person who has experienced sexual trauma needs to then work on their inner resources to strengthen themselves from within. Sexual trauma is an attack on a person's rights, on a person's decisions, and takes the power away from them to consent to something that is very intimate, such as sex. And that is why self-care is important, to help to rebuild the image that the survivor has about themselves. And this ought to be an ongoing process. And what I love about this tool, about this key, is that when you use it and you use it well, you continue to use it for the rest of your life. It's incredibly empowering. In the process of recovery, as a person is going through the grief and the pain and the mixed emotions and the complex and difficult emotions as a result of a sexual trauma, the person may have very little capacity or capacity or emotional strength to then begin to even think about self-care. And that is why it will be important that anyone who has struggled with who has experienced sexual trauma, with the support of family, professionals, or even group support or community support, that the person develops a self-care plan. What I like about a self-care plan is the plan means that you can change it. And the plan is also adapted to you, not to everyone. And having a self-care plan opens the opportunity for you who has suffered from sexual trauma as a survivor to begin to find out what it is about you and the things about you that you enjoy. To see your life in a positive light and in an empowering place in spite of what the abuser and the perpetrator did to you. A self-care plan is something that includes a range of things that you are going to do as a result of your trauma with the goal of healing. And it's important to break it down into different areas. It's okay to not follow through with the plan all the time, but having it written down somewhere on a postcard, giving it to a friend for accountability, and just having that, knowing in your mind that you have that plan itself, helps to reduce your stress level. Helps you to know that there are options, and they're healthy options to heal. So that instead of engaging in unhealthy outlets, maybe like addiction or risky behaviors like cutting or alcoholism or drug abuse, you begin to see your self-care plan as an alternative to those behaviors. And I don't want you to feel guilty if you have engaged in some of those unhealthy behaviors. All you're trying to do, unhealthy outlets, all you're trying to do is try to numb and find a way out of this emotional suffering. This is not to make you feel that you're worthless or people's perspective of you is negative perspective of you is true. It just means that instead of us just focusing on the unhealthy outlets, we're now beginning to develop healthy outlets so that we're not just stopping what we don't need to be doing, we're also engaging in the new behaviors that we need to be doing. Some of the behaviors in the self-care plan will be behaviors that you've engaged in before. Maybe prior to the abuse, you used to enjoy your life and not have any challenges that you have now. So you can strengthen those tools that you've used, and you can also discover new ones. So let's talk about what is going to be in the self-care plan. I want us to focus on the physical aspect of your being. I want to encourage you to go and get a physical done. Some victims of violence, victim/survivor of violence, have gone through like a forensic examination and interview, which is part of the process in terms of the legal process of investigating it, because it is a crime. That involves some level of connection with medical professionals that has a negative connotation because of the abuse. I want to encourage you to seek a primary care doctor, and if possible, establish one who you see regularly and you develop a relationship with, so that they can begin to talk about your physical health in positive terms. They can take your blood pressure, they can take your weight, and even if everything is okay, talking about your emotions with your primary care doctor is a very good start, and explaining what you have gone through. And then also focusing on any other tests that you need to do to make sure that you are not neglecting your health. Your body is a critical part of your healing process, because your body is where obviously you handle your emotions and you handle the emotional pain and even the psychic pain. So when your body starts to do better and you start to see your doctor and talk about what is going on, it can make you feel really empowered and positive about yourself, knowing that you are taking charge of your life in spite of what you have experienced. So that's the physical part. Now let's talk about the things you should do on a regular basis to take care of yourself. And again, if you have not done this or you have not been doing it, that's okay. The important thing you're going to learn about self-care and healing is that little is much. Start with what you can. And even not doing it some days, don't ding yourself for that. Just pick it back up from where you are. What are we going to try to do physically as a way of healing from something as traumatic as sexual abuse? I want you to pay attention to healthy eating. You can talk to a nutritionist to look at what you eat right now. And even if your weight is normal, feeding yourself with nourishing foods and with foods that have the color of the earth, vegetables, fruit, can be very empowering, makes you feel good. Drinking a lot of water. If you feel like your diet is not that good, like I said, talk to a nutritionist. They will guide you on how to read calories and how to choose foods that are positive. And that way, little by little, you begin to change some things. You are taking what is a very negative and traumatic experience and you're turning it around to self-care, to validating yourself and telling yourself, my body is worthy of good nourishment. I also want you to pay attention to sleep. If you've not been sleeping well, a lot of people who have been through sexual trauma have bad dreams, have nightmares. They're re-experiencing what they have suffered. Some people were abused at night, so nighttime is a very traumatic time. I want you to talk to your doctor about the possibility of getting an over-the medication to help you to improve your sleep. And even if it's an over-counter one, that's maybe you can try that, like melatonin. It's important for you to know that you want to keep same bedtimes most nights, even as you heal. You may not be as focused on it down the road, but I want you to do that now, which is going to bed. If you want to go to bed most of the time between 10 and 11, and then prior to going to bed, go through some routines to tell your mind that it's bedtime. The routines could be brushing your teeth, putting up your hair, if you're like me that does that, putting music in the room, having a soft throw next to you, whatever those bedtime routines are, shutting down your phone or dimming the brightness on your phone, turning off a TV, listening to jazz music, spiritual music, gospel, whatever that is. All those bedtime routines send your body and mind a message that it's time to go to bed. And again, if the nightmares are persistent, you may need to talk to your doctor as well as a psychiatrist to see if you can get some medication to reduce the severity of that. So that is the area of sleep. Sleep, appetite, exercise. I want to encourage you to take walks. I want to encourage you to go take walks. You can join a community group, a meetup group where people take walks, or a women's group or a men's group, or you can go with a friend and just take in nature. All that helps your mood and makes you feel that you're giving yourself permission to enjoy your life in spite of what you experienced. Now we've talked about the physical part. Now let's talk about the mental. I would recommend this strongly, that even if you do not want to see a therapist because you don't feel like you need it, and there are people who have gone through sexual trauma who would work through healing effectively with spiritual advice and support. So you don't have to see a therapist in order to get better. But I want to recommend that you actually get an evaluation done by a therapist, a psychologist, and somebody that is trained in trauma, because they can give you some objective findings as to how they think you're doing. So that gives you like a baseline. They can also let you know that some of the experiences you're having because of a trauma is normal, so you don't feel like you're weird. And also that what you're going through is weird or unusual. And also it helps you to have a resource. If you become depressed or the nightmares and the PTSD symptoms are persistent, at least you have somebody who knows you, who has some information about your history, who you can easily engage with. So again, check in with somebody and let them do an assessment of you. And they know what they're doing. They will do a thorough mental status, and they'll be able to come up with how you're doing. They will take some history, and they'll be able to see how you're coping based on what you've experienced in the sexual trauma and other things that may have happened prior to the trauma or after, since the trauma has happened. So we talked about the mental, we talked about the physical. I also want you to have a social connection. You want to be very careful about people that want to diminish your pain and are not allowing you to express how you feel in those times when you're overwhelmed. Nothing wrong with having family as a support, but it may be helpful if you don't want to do individual therapy, for example, for you to join a community group. You can do it virtually, you can do it one-to-one, and even if you don't feel like talking, hearing other people who have experienced trauma, sexual trauma, talk about their experiences can make you feel that there's a support in there. We don't always have to share what's going on with us, but hearing other people and them talking about their journey can be very validating and help you in your healing process. Now I want you to add to your self-care plan a safety plan. And for that, I want you to check out my video on how to have a safety plan for suicide. Not because you're planning to do that necessarily, but it's the same idea. Having a plan of who to talk to, where to go, what to do, if you get to a place where you are feeling unsafe to yourself and others. If you feel that you're going to engage in behaviors that could endanger you, like SIBs, injurious behaviors, severe injurious behaviors like cutting or eating disorders or thoughts of suicide, whatever those risky behaviors are, whether it is even having relationship with people that you know are unsafe, but because of a trauma, you don't feel like you can step away. I want you to have a safety plan. And it's not long or has to be detailed. Just write down the name of people, organizations, and things that you will do if you're feeling overwhelmed. And one of the way I advise that you do that, if you don't know where to start, is just Google it and look at these resources in your area. You can call those places as well and ask them, what kind of services do you guys provide for somebody who's gone through what I've gone through? And even though you may not want to use it then, having that awareness, that support is there is so important, because if you now become overwhelmed, you don't feel that you're alone and that there's nobody there for you. I want to encourage you, if you are somebody who has experienced sexual trauma, or you're a relative or loved one, friend of somebody, have a self-care plan. Don't feel bad if you don't follow it to the letter. It's okay. But review it regularly, make adjustments, and be willing to ask for help if and when you need it. So this ends my video on part 2 of healing from sexual abuse. I want you to like, subscribe, share. This is a very important topic, and if somebody has experienced sexual trauma, it is really important for them to know there are healthy options to explore and that healing is possible. And I wish you well in your healing journey. Talk to you next time. Bye now.